Good morning. Thanks for joining us. It's a little bit after 8:30 a.m. and you're at the Finance and Physical Resources Committee. Our first item on the agenda is public comment. Is there anyone from the public who'd like to speak this morning? All right, seeing none. Our next item is the consent agenda with the approval of the minutes from October 1, 2024 and the auditing of checks and purchase order activity. Is there a motion for the consent agenda?
So moved.
Any questions or comments? All right, seeing none, all those in favor, please say yes.
Yes.
Motion passes. Item number 3 comes to us from the Health Department, and it's adding 1.6 FTE public health nurse position for the early childhood millage lead prevention program.
Recommend to the Board of Commissioners approve the early childhood millage agreement from First Steps Kent for the lead prevention program, accept and appropriate $146,870 to the 2025 Health Fund budget, and authorize the board chair or health officer to execute the agreement, approve extensions, amendments, and increases to the grant appropriation not to exceed 15% of the award. Summary. The Health Department has been awarded $138,000 in early childhood millage funding from First Steps Kent to supplement the existing childhood lead poisoning prevention program. In addition, $8,870 will be received from the Michigan Department of Health and Human Services for services provided by staff. The Childhood Lead Poisoning Prevention Program provides case management to children under the age of 5 who have a blood lead level greater than 3.5 and are at risk for developing neurological disorders and an impaired ability to learn. In addition, program staff provide lead education and outreach services to primary care providers. Changes in MDHHS blood level requirements caused a significant increase in the number of children requiring case management. The Health Department has not been able to provide the necessary case management service to all eligible children with existing staff. The addition of the .6 public health nurse position will provide case management to approximately 60 children annually. The .5 health educator will provide education about lead testing recommendations, case management and resources through physician toolkits, and promoting the online training module to 16 primary care offices annually and 8 physician residents. The annual cost of the salary and benefits for the .6 FTE public health nurse position is $51,979, and the .52 FTE existing health educator position is $50,003. The remaining funds will support operating and indirect costs. If funding is eliminated or decreased, the positions will be eliminated unless continuation funding is approved pursuant to the fiscal policy on grants, contracts, and donations. Assistant Corporate Counsel has reviewed and approved the agreement as to form.
All right, thanks, Al. Is there a motion for this item? Moved by Commissioner Oliver King. Is there support? Support by Commissioner Wooden. Questions or comments? Commissioner Wooden.
Thank you, Chair. Just to confirm, the changes in MDHHS blood lead level requirements. I know that it is now standard that all children, I think at 2, have to take a blood lead level test. I could be wrong with the age, but did they also change the level in which someone meets the criteria to require case management? Was it a change in both standardization and a lowering of threshold?
Yeah, good morning. Yes, that is correct. Beginning in January of 2024, we went to universal blood lead testing for those age 2 and under. So you are correct. And then MDHHS also changed their requirement from 4.5 to 3.5. So thus, both of those things are causing the increase in the number of children that need case management. Yeah.
Forgive me, sorry. Follow-up question then. The increase that you've noticed, is most of that increase children getting tested that weren't getting tested, or children testing at the lower level below that threshold?
It's kind of a combination of both, but I would say the vast majority of them are from the universal blood lead testing. There's just more children being tested, therefore more kids. We're finding more kids.
I mean, that was the point, and while
Yes.
it's unfortunate that we have more kids that have tested positive, it does show this is a problem that's far more pervasive than we'd like.
Correct. That's correct.
You know, that was something that we had discussed during the 2016 lead task force, and it's awesome to see that's finally in place, the universal testing. I think it's really important to be able to find out if kids are impacted by lead, and all kids, not just specific zip codes or specific homes that they're living in. So that's fantastic. But yes, it does create a new problem where we maybe need to add a little bit more staff to address it. So any other questions or comments? All right. Thank you so much for the information, Gail.
Sure.
So all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. Our next item comes to us from the Administrator's Office, and it's the Behavioral Health Crisis Stabilization Unit Substance Abuse and Mental Health Services Administration Grant.
Action requested. Recommend to the Board of Commissioners to accept and appropriate a $750,000 grant from the U.S. Department of Health and Human Services Substance Abuse and Mental Health Services Administration, or SAMHSA, to the FY 2025 Special Projects Fund for the Behavior Health Crisis Stabilization Unit, and authorize the board chair or designee to execute the grant agreement and subrecipient agreement with Network 180, approve extensions, amendments, and increases to the grant appropriations not to exceed 15% of the original award. Summary: Kent County has received a one-year $750,000 grant from SAMHSA and has partnered with Network 180 as a subrecipient of the grant, which will be used for the Behavioral Health Crisis Stabilization Unit, the CSU. The goal of the CSU is to provide rapidly accessible intensive behavioral health treatment in a secure non-hospital setting and to prevent unnecessary emergency department, law enforcement, and inpatient hospital usage for individuals experiencing behavioral health crises. To effectively meet the community's crisis behavioral health needs, it is essential that the CSU serve all individuals presenting in crisis, regardless of their insurance type or coverage status. However, there is not yet a funding source for approximately 29% of individuals likely to present at the CSU in crisis, which include those who are uninsured or whose coverage does not include behavioral health crisis services. The SAMHSA grant will cover the costs of serving those individuals without funding coverage. The grant period runs from September 30, 2024 to September 29, 2025. Prior to signature, Assistant Corporate Counsel will review and approve all documents as to form, including the subrecipient agreement.
All right, thanks, Al. Is there a motion for this item? Moved by Commissioner Sparks. Is there support? Support by Commissioner Merchant. Questions or comments on this? Yes, Commissioner Antor.
Thank you, Chair. Al, this is a one-time, looks like a nice windfall for us for this program. Will all the money be used for uninsured people then, or are we going to use some of this for equipment for the mobile unit, or kind of?
Josh Spencer has actually been the one who actually wrote the grant and worked with our Congresswoman to get it, so I'll have him answer that.
Thank you.
So yes, all the funding from this will go to serve those who are uninsured or underinsured. So there won't be any equipment. It'll all be direct services.
Do you know how long that will sustain? That'll go on for until this money runs out?
Well, they anticipate that they will use it all, that they'll have that individuals that present themselves that do not have coverage. I'll note that we were actually fortunate to get this into the federal budget again, so we'll see what happens with that process. But there's a chance we'll have it again next year as they get more of a runway so they can negotiate to have more plans cover this kind of care. Yeah.
If somebody was in here and it's an ongoing situation where they need help for several years and the money dries up, will they then, how does that work, I guess?
Well, my understanding is those folks are being served now. It's just who's going to cover that gap, and this provides a way for us to do that while we figure out how to get those individuals covered.
And was there any physical needs we need for the mobile unit or anything like that? Is that all?
I can't speak to that. I believe there are, but it would not be this grant. Yeah.
All right, thank you.
If I could mention, as just to flesh out a little more of something Josh said, this unit is so new. It's the first in the state of Michigan. I think Detroit finally got theirs up. There's maybe one or two more in the works. That really, it's kind of plugging the gap until we can get the health plans to cover this. So the idea is this may be needed in the near future, but hopefully not for the long future, as efforts are made to make that part of the plans.
And now, to get people up to speed or to cover health plans, I mean, health insurance doesn't cover some of this right now. Is that going to be remedied through the legislature somehow, or?
I think it's more negotiating with the plans themselves.
Yeah, they have a lot of discretion on what they cover, so there's a lot of negotiations with the companies that are providing this care to
Oh, okay.
add it as a benefit. Yeah.
Okay, thank you.
I think a lot of it too is for health plans to realize the benefit of this and, the wraparound care that the people will be receiving. And, in many ways, it is, a costly thing to run, but I think in the long term, it could be very beneficial. So it's a great thing to have in our community. Commissioner Coleman?
Thank you, Chair. I just echo that. I think the CRIS stabilization unit is just a great asset in our community and so important. And I'm just curious, the way I read the 29% figure is that was an estimate. I'm just curious if there, with just a few months under our belt over at the CSU, if there's any trending data to know if it's going to be, that figure, around that, 29% figure.
I don't have that offhand, but we can send that to you as a follow-up to this, yeah.
All right, thank you. Any other questions or comments? All right, seeing none, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. That brings us to item number 5 from the Equalization Department, and we have the 2024 apportionment report.
Action requested. Recommend to the Board of Commissioners to approve the 2024 apportionment report summary. The General Property Tax Law Act, PA 206 of 1893, as amended, outlines the responsibility of the Board of Commissioners with respect to the annual apportionment report. The Board of Commissioners examines certificates of each local taxing jurisdiction and directs millage rates to be spread on taxable valuations. The Board of Commissioners also determines the dollar requirements necessary to fund the assessment for drains to be spread on the respective township and city rolls. Attached is a 2024 apportionment report as prepared by the Bureau of Equalization.
All right, thanks, Sal. Is there a motion for this item? Moved by Commissioner Hildenbrand. Any questions or comments? We do have Megan Van Hoos here, our apportionment or equalization director. If there's any questions or, yes, Commissioner Wooden.
Does Commissioner Hillenbrand's motion need support?
Yes.
Support.
Support by Commissioner Wooden. Thank you for keeping us in line. Any questions or comments regarding this? All right. Seeing none, all those in favor, please say yes. Yes. All those opposed, please say no. Motion passes. And that brings us to our item number 6 on the agenda, Commissioner Miscellaneous. Is there any Commissioner Miscellaneous? Nothing? All right. We are adjourned, and our next meeting will be on Tuesday, November 5, and that just happens to be Election Day. So hopefully you all go out there and vote early, and hopefully on November 5. It's a great day. Have a wonderful Tuesday.